Hi everybody, welcome to this live. I'll just add Dr. Akshat to the live. Hi Dr. Akshat.
Hi, good evening. How are you doing,
Welcome.
doctor?
Fine. Welcome to Eyes on Health. It's such a great pleasure to have you on board today.
Thank you so much
So
for having me.
just to introduce the session, Eyes on Health is all about your eyes and how it is linked to your health.
Yeah.
And we are very lucky and we are very privileged to have Dr. Akshat today here. Now, he needs little introduction, but I'll still do that. He is a lifestyle medicine expert. He's a TEDx speaker. He's a physician, of course, and what I would like to call him as a healthcare influencer. Uh, so, so, the focus on today's talk. Recently, we had the World Diabetes Day on 14th November. So it's a series where we are focusing on diabetes and especially how it affects our eyes.
Correct.
Let's keep it in a mix of English and Hindi, right? So, Dr. Akshat, सबसे पहले आपसे मैं डिस्कस करना चाहूँगा कि as a retina specialist, daily in my practice, I see a lot of diabetes patients who are devastated, simply devastated by this disease.
Yeah.
And as a physician, you must be seeing its effects on the other parts of the body as well. So,
Correct.
उसको डिस्कस करने के लिए still it's very unfortunate that we see कि बहुत सारे patients को हमारे अभी भी नहीं पता है कि डायबिटीज क्या है, उसके symptoms क्या है, how to start getting the feel that you are a diabetic. So,
Correct.
Dr. Akshat, first question: what is diabetes? Just the basics, and what could be the symptoms for it?
Okay, so in a nutshell, okay, diabetes means कि आपके blood में sugar बढ़ गया है. So the blood sugar has started increasing. So that is diabetes. You have type 1 diabetes, you have type 2 diabetes. There are different types of diabetes. We'll not get into the nitty-gritty of that because eyes में any type of diabetes will affect the eyes if the sugars are uncontrolled. But why it is happening is because so you have the pancreas, you have the beta cells in the pancreas, जिसमें से insulin जो hormone होता है insulin निकलता है, and insulin is responsible for removing that sugar from the blood, putting it into the cells for utilization. So when you talk about diabetes, what happens is that either the insulin is not getting formed at all, which is predominantly type 1 diabetes के insulin बन ही नहीं रहा है. So जो भी आप खाना खा रहे हो, it is getting broken down into sugar, and instead of going into the cells, it is flowing into the blood. Okay. And the other type, when we say more of type 2 diabetes, insulin बन रहा है, but it is either not meeting the cells properly, which is insulin resistance, या तो दूसरा है कि जितना भी इंसुलिन बन रहा है, it is not enough, that is insulin deficiency, and धीरे धीरे that insulin deficiency can go into complete zero insulin also. So type 1, type 2 में थोड़ा सा, this is the main differentiation, but what we need to understand from a diabetes perspective, yes, we are eating, food is getting broken down into sugar, the sugar needs to go into the cells. तो cells के अंदर जाने के लिए आपको चाबी लगती है जो आपका इंसुलिन है. So either when you're a diabetic, either the insulin is not getting produced or it is very less, or it is getting produced, but जो ताला and lock है, they are not really meeting each other, fit नहीं हो रहा है, तो insulin resistance बढ़ता जा रहा है. So predominantly that is diabetes. What are the symptoms of diabetes? Now, आधे से ज़्यादा, I think more than 50-60% of the people have zero symptoms of diabetes. They go in for a health checkup or a pre-employment checkup, and उसमें report दिखती है HbA1c, that is a 3-month sugar average, or a blood sugar level, or a fasting blood sugar level, or a postprandial blood sugar level. Fasting blood sugar, we normally like to keep it below 100, and postprandial, we like to keep it below 140 as normal. So if your sugars start going above 100, above 40, then you're going into pre-diabetes, which finally goes into diabetes. Above 200 postprandial hoega, so that is frank diabetes basically. But when the levels are maybe less than 140, you might not get symptoms. You might get symptoms also. So we don't really wait for symptoms, but predominantly what are the symptoms अगर आप पूछो. So one is तो जैसे बोलते हैं polydipsia, मतलब प्यास बहुत ज़्यादा लग रही है. मतलब it's not very hot and all, but you tend to drink more water, especially compared to the other people, or as a habit कि पहले तो हम सिर्फ 1 लीटर पानी पीते थे. Now suddenly, without any effort, I'm drinking 2.5, sometimes 3 liters of water, 4 liters of water also without any effort. So that is polydipsia. Then polyphagia. भूख ज्यादा लग रही है, अभी खाना खाया था फिर से भूख लग रही है, माय पोर्शन साइज हैज इंक्रीज, हम ज्यादा खाना खा रहे हैं, पॉसिबल रात को मिडनाइट क्रेविंग्स बढ़ रही है, उठ उठ के खाना खा रहे हैं, सो गए थे बट उठ गए, सो पॉलीफेजिया हो सकता है। देन यू हैव अनएक्सप्लेन्ड वेट लॉस हो सकता है कि नॉट रियली मेकिंग एन एफर्ट हो गया, और द अदर वे अराउंड कि आपने बहुत ज्यादा वेट गेन कर लिया, व्हिच हैज काइंड ऑफ पुश्ड यू इनटू डायबिटीज आल्सो, जैसे मेटाबॉलिक सिंड्रोम बोलते हैं। देन यू टॉक अबाउट वुंड्स व्हिच डोंट हील, मतलब आपको चोट लग गई है, मतलब जस्ट स्मॉल स्क्रैच है या पैर पे लग गया, बट यू हैव पुट योर व्हाटएवर बीटाडीन वगैरह लगा दिया, डॉक्टर को भी दिखा दिया, कभी कभी तो दवाई भी ले ली, एंटीबायोटिक भी ले लिया, बट वुंड्स आर नॉट हीलिंग। सो दैट शुड आल्सो काइंड ऑफ कि शायद दिस इज समथिंग इज नॉट राइट। देन सडन चेंजेस इन द मेंस्ट्रुअल पीरियड कभी कभी विमेन में भी हो सकते हैं, it could be people mistake it for thyroid or sometimes even PCOS, but you have to check even your HbA1c levels basically. So these are predominantly the symptoms that you can look for. But what I've actually been reading about is something that you can throw light on, sir, is that the eyes give a lot of signs of diabetes. So what do you have to say about that?
Right. So thank you, Dr. Akshat, for that wonderful information. I feel that is very valuable, and all of us should be aware of this. See, eyes, as you have told, body ko jaise affect kar raha hai, so it definitely affects the eyes. To start from a very simple thing like dry eyes, अगर हो रहा है बहुत फ्रीक्वेंटली हो रहा है, इट्स नॉट गेटिंग, आप थोड़े ड्रॉप्स लेते हो नहीं मैनेज हो रहा है, डायबिटीज कुड बी अ कॉज, राइट? सो व्हाट हैपेंस इज देयर आर सर्टेन ग्लैंड्स इन द आईज व्हिच प्रोड्यूस टीयर्स, सो उसकी नर्व सप्लाई एंड ओवरऑल द ग्लैंड इज अफेक्टेड बाय दिस डिजीज, सो उसका प्रोडक्शन कम हो जाता है, व्हिच लीड्स टू डायबिटीज. Another very common thing that happens is cataract, what we call as motiabin.
Correct.
So that is also either accelerated or it comes in early in these patients. बेसिकली जो प्रोटीन और जो फाइबर्स हैं हमारे लेंसेज में, उनका मेटाबॉलिज्म इफेक्ट हो रहा है. दीज फाइबर्स आर सपोज्ड टू बी ट्रांसपेरेंट, पारदर्शी होने चाहिए, उसके थ्रू लाइट अंदर आती है, बट दे आर लूजिंग इट्स ट्रांसपेरेंसी, सो दैट लीड्स टू कैटरेक्ट. Another very dangerous disease is glaucoma. We do not have a very clear understanding why it happens more with diabetics, but a lot of epidemiological studies and लोग समझे जैसे सर्वेस किए जाते हैं कि कौन कौन सी बीमारियां कॉमन है, तो इट वाज फाउंड दैट डायबिटिक्स में ग्लोकोमा, स्पेशली द नैरो एंगल ग्लोकोमा, ओपन एंगल ग्लोकोमा ज्यादा कॉमनली दिख रहा है. देयर इज अनदर फॉर्म ऑफ ग्लोकोमा व्हिच इज नोन एज नैरो एंगल ग्लोकोमा, जब डायबिटिक रेटिनोपैथी बहुत एडवांस हो जाती है. सो वन थिंग दैट वी कॉल एज नियोवैस्कुलर ग्लोकोमा, which is absolutely sight threatening. The patient can go blind. That is also a type of glaucoma that happens at the end of the course for diabetic retinopathy. And सबसे common जो हम देखते हैं, and as a retina specialist जो सबसे commonly मैं देख रहा हूँ, that is diabetic retinopathy. It's all about raised blood sugars in your blood vessels that are there in the retina, and बहुत it affects the eyes, the vision a lot. Right, so these are the basic diseases that are affecting the eye.
Would you say कि अगर आप एक डायबिटिक की आंख देखो और एक पर्सन जिसके डायबिटीज नहीं है, so do you see any differences in both the eyes?
Right. So again, if I see a young patient, एक specific type का cataract है which we call as the posterior subcapsular cataract, and there's a certain type of cataracts जिसको हम देख के we can diagnose that this looks a lot like a diabetic cataract, diabetes की वजह से होने वाला cataract. कई बार as you were saying कि infections वगैरह का rate ज़्यादा होता है, injury that is not healing. Lot of times similarly we see lid infections, eyelid में infection हो रहा है, eye के आसपास infection हो रहे हैं, बहुत common, बहुत frequently. So in patients, precisely, and in patients which are maintaining good hygiene of the eye, so उसमें भी अगर हो जा रहा है तो that indication that is there. And जो रेटिना है, that is the only part of the body I would feel जहाँ पे आप blood vessels को directly visualize कर सकते हो. So whatever little impact these diseases have on the body, a lot of them we can pick up from retina, like hypertension, like diabetes. A lot of patients, we tell them that you have diabetic retinopathy and they are not aware, right? So much so what that can be clearly made out. People with very good control, may not have any symptoms as such in the eye, any signs as such in the eye, but we would feel that 80% of patients with 8 years of diabetes, with 5 years of diabetes, will have some changes, and
Okay.
almost 99% patients of with a duration of more than 10 years of diabetes will have diabetic retinopathy changes in their eyes. Yeah. Right. So, Dr. Akshat, now we have covered कि क्या क्या हो रहा है, अब उसका करें क्या? So, from my personal perspective, from the kind of patients, I'm very concerned. मुझे बहुत परेशानी होती है कि कई बार I see कि diabetes progress करती जा रही है. So, how do we prevent diabetic retinopathy from happening from your perspective, from a physician's perspective?
Correct. So what's the first most important thing is if you want to prevent diabetic retinopathy, then I think you should first is prevent diabetes. I think agar diabetes ही नहीं है तो फिर the chances of diabetic retinopathy are zero, right? That's the whole point. So the point is that when you talk about prevention of diabetes or diabetes retinopathy, it's the answer remains the same. That is your lifestyle. A lot of people come and say that, sir, मेरे family history बहुत strong है diabetes, मुझे तो होना ही है, डायबिटीज भी हो जाएगा, आंखें भी खराब हो जाएगी, किडनी भी खराब हो जाएगी, तो व्हाट डू वी डू, सो आई ऑलवेज टेल देम दैट डोंट थिंक अबाउट द फैमिली हिस्ट्री, यू थिंक अबाउट व्हाट इज योर करंट लाइफस्टाइल टुडे. बिकॉज ठीक है आपकी फैमिली हिस्ट्री में है, शायद ऑफ कोर्स यू आर प्री डिस्पोज, सो दैट मींस यू हैव टू टेक इट एज अ रीजन टू इवन ट्राई एंड प्रिवेंट इट इवन मोर, कि आपको और ज्यादा आपका ध्यान देना चाहिए कि ये नहीं हो बेसिकली, बिकॉज वो ट्रिगर आपको आपके हाथ में है, गन आपके हाथ में, ट्रिगर आप कब करोगे आपके अभी अभी आपको 20 की उम्र में हो, 50 की उम्र में हो कि 70 की उम्र में हो, दैट इज इन योर हैंड, so that is something that I do believe in, so predominantly lifestyle is what you do every day. आप क्या कर रहे हो, आपका रूटीन क्या बन रहा है, क्या खा रहे हो, क्या पी रहे हो. सो द पिलर्स ऑफ लाइफस्टाइल नॉर्मली आई ब्रेक इट डाउन इनटू अबाउट 6 पिलर्स जो होते हैं. सो वन इज फर्स्ट इज योर न्यूट्रिशन. So people tell ke diabetic diet, I need to be on a diabetic diet. So see, personally, I don't think that you need to be on a diabetic diet. I don't think you should use the word only a diabetic diet. I think what you need is a well-balanced diet where you're eating on time. I think that is very, very important. I think late dinners and सुबह, उठ के 4-5 घंटे कुछ नहीं खाया हुआ है, so I think those are things which need to change because we are living in a very fast-paced world. किसी को खाने के लिए time नहीं है, lot of us are fast eaters. फटाफट खाते हैं, फटाफट 5 मिनट में inhale the food and then काम पे लग जाते हैं, so which again affects even the gut health. तो अगर आपको एसिडिटी है, कॉन्स्टिपेशन है, ब्लोटिंग है, गैसेस है, बेल्चिंग है, सो देन इवन व्हाट यू ईट, अगर आप डाइजेस्ट ही नहीं करोगे तो आपका शुगर कहाँ बहेगा? इट्स ऑब्वियसली गोइंग टू गो बैक इनटू द ब्लड, राइट? सो दैट्स वन वेरी इंपॉर्टेंट थिंग इज दैट यू हैव टू कॉन्सेंट्रेट ऑन योर गट हेल्थ. सो व्हाट यू ईट, व्हाई यू ईट, व्हेन यू ईट, हाउ यू ईट, बहुत ज्यादा जरूरी हो जाता है. तो अगर आप बोलो कि मेरे को एक गिव मी एन आइडिया कि कैसे प्लेट कैसे लगनी चाहिए, अगर आपको अगर बैलेंस मील खाना है, तो अगर आपकी प्लेट बन रही है, तो वी हियर अ लॉट अबाउट प्रोटीन. ओके, it's fine, sometimes a little exaggerated, but protein is very important, predominantly because we don't eat enough of it, इसलिए उसका importance बढ़ जाता है. But what we are missing out, especially when it comes to prevention of diabetes or diabetic retinopathy, is fiber. अगर आप सब्जियां नहीं खाओगे, then you are headed for even more trouble. So even things like you hear about vitamin A, you hear about antioxidants, you hear about lutein, you'll hear about zeaxanthin, you'll hear about vitamin E. तो ये सब सब्जियां में इनफ मिल जाता है. प्रीडोमिनेंटली यू टॉक अबाउट डार्क ग्रीन लीफी वेजिटेबल्स, यू टॉक अबाउट पर्पल फूड्स, you talk about yellow, orange, red, all of this will give you vitamin A, beta carotene, or you'll get everything there if you just eat your vegetables. And these are actually very important for your eyes, even for the retina.
True.
So it's not only the eye muscles or anything, it's actually even important for the retina. So we have to understand that your vegetables are important. And at the same time, अगर आप सब्जियां ज़्यादा खा लो, then automatically the जो peak of the sugar होता है, when you eat carbs वगैरह जो भी खा रहे हो, चीनी खा रहे हो, the peak will actually kind of get flattened out a little bit and then will come down more easily. So जब भी peak होता है तो insulin ज़्यादा waste हो जाता है. So we have to conserve the insulin. So if you just increase your fiber intake, 2 portion fiber कर लो. Fiber I'm talking about predominantly vegetables. Fruit is also fiber, agreed, but never to mix fruit with the खाना. Cooked meal के साथ नहीं खाना है. 1 or 2 fruits per day, mid meal हो गया, pre workout हो गया, या सुबह उठते सार ले लिया, no problem. No fruit juices, no milkshakes, no fruit smoothies at all. Vegetable juices, please go ahead, no problem. Karela वगैरह, very good, enjoy yourself, but no fruit juices. Then you come to proteins. So if you can balance your protein, ओके ठीक है, दाल में भी कार्बोहाइड्रेट है, बट व्हेन यू आर टॉकिंग अबाउट व्हेन यू आर वेजिटेरियन डाइट, दाल, राजमा, छोले, पनीर, सोया, और व्हेन यू टॉक अबाउट नॉन वेज, यू टॉक अबाउट एग्स, you talk about chicken, you talk about fish. I'm not a too much of a red meat person at all, so I prefer no. I mean मत खाओ, because free radical inflammation वगैरह ज्यादा हो सकता है, so I prefer not to encourage people for red meat. But non vegetarian अगर आप हो, 2 बार हफ्ते में, 3 बार हफ्ते में खा रहे हो, no problem, that's a choice. Preparation again will matter, तेल वगैरह कितना जा रहा है, मसाला कितना जा रहा है, all those things will matter, so you have to be careful. But apart from that, take your protein and then take enough carbohydrate with that protein. Your digestion will not get affected, because if you take very high proteins, आपकी पूरी प्लेट में सिर्फ राजमा ही राजमा दिख रही है, then gases वगैरह डाइजेशन में इश्यूज हो सकते हैं, so you need to be careful about that. पर अगर आप इतना सिंपल अपनी प्लेट डिजाइन करो, 2 फाइबर कर लो, 1 पोर्शन प्रोटीन कर लो, 1 पोर्शन कार्बोहाइड्रेट कर लो, you will be fine. So according to me, balance कर लो, उसके साथ hydrate yourself well enough, 2-3 liters of water, you're sorted. ठीक है? Then the next pillar, which is I think the most difficult pillar, is exercise. I mean, there are recent studies which are clearly showing that exercise even improves circulation in the eyes. So what are we waiting for? तो कुछ भी करो, walk, yoga, pilates, gymming, weight. See, I'm a gymmer, so I do believe in the power of weight training, even from a muscle gain perspective. But if everybody's not okay to do it, but even if you think about yoga or something, why not? 30 minutes कर लो, 40 minutes कर लो, 5 days in a week कर लो, 4 days in a week कर लो, but don't stop. I think consistency is what is important. Then comes sleep. I think sleep is something which is underestimated. Our eyes are constantly on screens. The only time they shut is when they sleep. तो अगर आपको अपनी आंखों को बचाना है, you spoke about dry eyes. सबसे बड़ा concern with the dry eyes is the screen. So अगर आपको आंखों को बचाना है तो सो जाओ बस. I think that is very clear. Then you have the stress levels. I think stress levels just kind of changes, how your body is responding to things, And what I was reading about is also your जो pupils होते हैं वो dilate हो जाते हैं to increase the amount of light which goes inside, which helps you kind of deal with the stress, So all these things are very important when it comes to just dealing with your eyes. Then we talk about medications, we talk about supplements. We have a lot of supplements. One supplement which I want to mention over here is vitamin D. I think we have enough proof and enough studies to show that when you are talking about eye health, diabetic retinopathy, you cannot be vitamin D deficient. तो आप कुछ भी कर लो, vitamin D deficient मत रहना. Vitamin B12 and folic acid. These 3 things you have to be careful. Please don't be deficient in this at all. उसके ऊपर vitamin E, A, lutein वगैरह, everything is there. But first is D, B12 and folic acid. Then you talk about monitoring. Sugar है, नहीं है, blood pressure है, नहीं है. If these things can be monitored, then I think you will be able to prevent diabetes and diabetic retinopathy. I think that is what is important. But I want to ask you, sir, manage चलो, prevent तो शायद कर भी ले. But there is a lot of misinformation कि अगर diabetic retinopathy हो गई, if I get diabetic retinopathy, there's no cure, I'm going to lose my vision. Absolutely. Medicine भी नहीं है, management नहीं है. What is your take on this? I think this is something which is playing on everybody's mind who is suffering from retinopathy.
Yes, Dr. Akshat, and thank you for beautifully laying out. And a lot of people think it's a rocket science कि कैसे diabetes अपनी plate कैसे design करनी. You just laid it for us. Again, coming to your question, that's a complete myth. I have patients who have, as I said before, also almost 10 years of diabetes. Diabetic retinopathy changes भी हैं, but time पे उनको पता चल गया, right? And they are 100% vision over a very long course of time. So number one thing I would say is, regular checkups, right? First and foremost, you need to know whether your diabetic retinopathy has started or not. Once you know that it has started, आपको पता चल गया कि disease एक certain stage पे है, right? Controlling in it to get aware. Once the patient realizes, when we show them on our screens something called as fundus photographs, where we take the eye and we can actually show them कि ये bleeding आ रही है, these are the changes that are happening. Then the patient actual जब change दिखता है, अभी body कुछ और change आ नहीं रहा है. So then they get there. So awareness and controlling your blood sugar levels. This is the number one thing. Number 2 is another myth is, a lot of patients come to us कि आप दवा लिख दो इसकी हमारे लिए. So let me tell you that no medication as such. There are certain supplements, as you said, and certain drops which might help things like dryness, a little amount of swelling जो पर्दे में आ गई उनको help कर सकता है, but nothing more than that. The mainstay of treatment for us when diabetes reaches to a certain level, there is something known as diabetic macular edema. अगर उसको समझें तो पर्दे डायबिटीज की वजह से सूजन आ रही है. The retina swells up and it causes loss of vision. उसके लिए we need injections. Now these injections are very costly and need frequent administration of these injections. बहुत at least monthly administration देना पड़ता है for at least 3 to 4 months. And there are a lot of patients who need these injections for a very long time. 1 साल 2 साल भी चलते हैं. So it's a huge burden on them financially and emotionally and otherwise as well. So that's another incentive to control कर लो अपनी शुगर, थोड़ा पैसा बचा लो. So एक जो पहले बहुत होता था, लेजर्स का नाम सुना होगा, रेटिना के लेजर्स. अब थोड़ा हो गया है because we rely more on injections. Laser का अब role is limited to in cases who are not being able to afford the injections and people जहाँ पे हमारे injections बहुत ज़्यादा हो रहे हैं and we want to take care of them with the help of lasers. And another indication is जब diabetic retinopathy has reached its second stage, where the bleeding is coming and a lot of other things are happening, then we laser the whole retina. Lastly, at times there is bleeding inside the eye. The bleeding is so much कि vision बहुत ज़्यादा drop हो गई है. There's another thing that is known as retinal detachment, diabetic retinal. उसको treat करने के लिए we need surgery. Surgery भी अब the equipment that we use, they are very fine equipments and we are getting very nice results timely अगर ये सारी चीजें हो जाए. So these are the basic modalities, but nothing beats a good control, right? So absolutely. So Akshat, one thing a lot of my patients, of course everybody is under the care of a physician, but Thora, if you can tell us about what investigations are relevant for our patients, कुछ चीजें ऐसी जो वो खुद कितनी frequency पे करा लें और उनको कैसे monitor करें, so that will be very helpful.
So I think any diabetic, whether they have any complications or not, I think one to is the hemoglobin. CBC is something which must be done. Then fasting blood sugar, postprandial blood sugar. एक तो आपको ग्लूकोमीटर के साथ मॉनिटरिंग करना बहुत जरूरी हो जाता है. I generically can tell anybody and everybody at least fasting once or twice a week you should do, and postprandial, that is 2 hours after a major meal, at least twice a week. जैसे कभी 2 घंटे ब्रेकफास्ट के बाद हो गया, 2 घंटे लंच के बाद हो गया, 2 घंटे डिनर के बाद हो गया. So let's say 2 or 3 readings of sugar per week with the glucometer should be done. Same breath में I will tell कि जो घर पे monitoring है blood pressure, whether you have BP or not, I think keeping a BP monitor at home, if you already have diabetes, this is for them. At least once a week, if your numbers are, let's say, going above 130, 85 हो रहा है, 135 दिख रहा है, it's a good idea to keep a check. If it's 120, 80, ठीक है. अगर आप महीना, 2 महीना, 3 महीने में भी अगर आप घर पे भी चेक कर लो या डॉक्टर के पास जाके भी चेक कर लो, it is okay. But if you notice that the numbers are going beyond, you should be careful. And if you already have blood pressure and you're on medication, then at least once a week, सुबह के टाइम and once a week शाम को अगर आप BP चेक कर लो, it's a good idea, because tomorrow if you say I want to reverse my diabetes, I want to reverse my blood pressure, even if you go back to the doctor and say कि मुझे दवाई कम करनी है, they will ask you, please show me last 3 महीना 4 महीने आपके नंबर कैसे रहे, because how can anybody reduce it by seeing one number? So having a track record is always helpful. Okay, then back to the thing, then one is CBC, okay? Then it is HbA1c. Normally we say HbA1c at least once in 3 to 4 months you should do. Very beautiful control अगर आपका बहुत अच्छा है, less than 6.5, 6.6 चल रहा है, 6.2 चल रहा है, at least once in 6 months you should do. Okay, same way lipid profile, cholesterol, triglycerides, good cholesterol, bad cholesterol, same way. I mean, if very good सब ठीक है, at least once in 6 months करा लीजिए, once in a year तो minimum I think is recommended for everybody. Okay, then you have something like the liver function test, SGPT, SGOT, GGTP, these are important. Then you have the RFT, that is your renal function test. Uric acid is very important, creatinine is very important. So even if all numbers are good, even if you do it once a year is okay. But if you're tracking, अगर आपका क्रिएटिनिन बढ़ना शुरू हो गया है, 1.2 1.3 दिख रहा है, then your doctor will automatically tell you to say at least once in 3 months they will make you check, so following those orders are necessary. And then you have, I think, thyroid. Don't forget the thyroid. Even if you don't have thyroid, साल में एक बार TSH at least check करना is a good idea. And last but not the least, I would say is vitamin D and vitamin B12. I think वो बहुत easily kind of miss out हो जाता है. They are expensive tests. I will not deny that. तो अगर आप साल में एक बार भी कर लो, and then you are on the supplementation and you don't miss your doses, या एकदम भूल अभी दिवाली आ गई तो मैंने सब छोड़ दिया. If you don't do that, then even if once a year, if you check these numbers, you're going to be good. And I think from an eye perspective, what you spoke about the fundus photo, I think what is recommended at least once in a year, every diabetic has to check. Is that correct? What are your suggestions?
So what we suggest, earlier there were certain different guidelines, but from a very practical standpoint, अब आजकल we say जैसे ही diagnosis हो रही है, and that I will recommend all our physician friends also to emphasize on this point. All of them write it in their prescriptions. At times it is not emphasized enough कि जैसे ही diagnosis है, get your retinas checked, preferably from a retina specialist. Yeah. Ophthalmologist, be general ophthalmologist, also you can do it. But if a specialist is accessible to you, just go to get your retinas checked. One test that we have already mentioned, fundus photo, that has to, because that is a photograph of your retina and it helps us in documenting the case. Of course, we have our notes, prescriptions, but a photograph, like a photographic documentation.
Same like a track record. Now you have something to compare to.
And if you're maybe taking the prescription to some other doctor, he knows what was the condition a year ago, right? There is something known as an OCT, which is crudely, if you say it's like a CT scan of the retina, which gives us all the layers of the retina. So कोई भी edema है, कोई भी bleeding है, we'll be able to catch it. Another thing is an angiography. जैसे heart की angiography होती है, we do the angiography of the retina as well. And it helps us in differentiating between non-proliferative and proliferative. Like type 1 and type 2 diabetic retinopathy को differentiate करने करता है. So we can take the decision whether we have to laser the patient or not, right? So all of these tests, fundus photo, I would recommend all diabetics to get it done annually. OCT and angiography, your ophthalmologist or your retina specialist will guide you कब करना है. But और जिनको disease है, they will need maybe a monthly or a 3-monthly follow-up. So retina specialist या ophthalmologist से आपका साथ जीवन भर का है, and that has to be followed, like with the physician, right? So I think we had a beautiful conversation. There are certain audience questions. Maybe we can cover them. We have 2 to 3 minutes. Anuj Trehan had asked, I'm pre-diabetic and have a family history of diabetes. How can I prevent it?
I think we've answered that.
And a very beautiful example you gave of the trigger. So what Dr. Chaddha said, that गोली है उसमें, but trigger चलना है कि नहीं वो आपके हाथ में है, right? So that's beautifully put. And if I can see some other questions. Okay. Somebody has asked, I have a question. Whenever I drink water, I have to go pee within the next 30 minutes. I think that's not very relevant.
No, unless you have an infection or you're a diabetic already.
Right.
Or you're gulping water very, very fast. If that's another problem that you need to look into.
Right. And how to stop optic nerve from damaging. So as we have discussed, glaucoma हो सकता है, and उसका damage diabetes को रोक के ही होगा. And we have to assess whether diabetic retinopathy के किस वजह से glaucoma हो रहा है. And simple drops can help us treat initially. Okay, so Nidhi Chawla Arora is asked, only taking eye drops like Careprost is sufficient in glaucoma? No, Nidhi, that is not sufficient. आपके ophthalmologist बताएंगे क्या drops चाहिए. And कुछ glaucoma के tests होते हैं which have to be done on a regular interval. They decide कि हमारा क्या drops हमारी चलेंगी. Then again she has asked, how often should a glaucoma patient visit a doctor? Again, आपके physician, आपके ophthalmologist आपको बताएंगे. There's another question about allergy, which we can skip. I think we are done, Dr. Akshat.
Yes.
So
There
it
are
was
more questions. Yeah.
yeah. Anything relevant that can you see?
ये तो कोविड वगैरह है.
Can we get a recording of this talk? Definitely.
I think
We'll send that
we're going to post it, right? हमारे दोनों pages पे आ जाएगा.
आ जाएगा.
I think we've covered it. I think what we can do is, if anybody has any questions, then once we post the recording, feel free to put it in the comments, and either one of us will kind of answer that.
Again, thank you so much. It was such a pleasure talking to you, and I hope we can do this again. It was
Yes,
very
definitely we should.
and we should collaborate more often, right?
Sure.
Such a pleasure.
Okay. All right. Thank you so much. Thank you everybody for joining. Thank you.
Thank you.
Bye-bye. Bye.
Bye-bye.